Welcome back, guys. Welcome to Talking Health with Anikia. I am a registered nurse and I recently became a family nurse practitioner. We are going to be looking at the need to know about high blood pressure and potassium-rich foods. High blood pressure is the leading cause of heart disease, strokes, and renal failure. Half the adults in the United States have high blood pressure, and according to the Center of Disease Control, only 1 out of every 4 adults have their blood pressure under control. The average American diet have way too much salt and too little or not enough potassium. And this is one of the reasons why so many persons have uncontrolled hypertension or high blood pressure. Potassium in the diet is very helpful when you have high blood pressure, and it is helpful for lowering blood pressure. But we have to be careful because a high potassium diet is definitely not for everyone. There are certain medications and certain disease states that will prevent you from having a high potassium diet. In situations like those, it is very important, and not only in those situations, but if you have high blood pressure, it is recommended and it is very important that you work alongside your healthcare provider on your journey to lowering your blood pressure. With that said, let us look at the need to know about high blood pressure and potassium-rich foods. First, we're going to look at tomato and tomato juice. Yes, tomato and tomato juice, they are rich in potassium. But when we're consuming tomato or tomato juice, we want to ensure that they are fresh. We do not want to consume especially canned tomato juice. With that said, I'm going to refer you to watch my video, 8 Worst Foods You Want to Avoid in 2023 when you are hypertensive. In that video, I explain why it is important not to have canned foods. So this will bring a better understanding as to why you would not want to consume canned tomato juice. Instead, have fresh tomato juice. Also remember that when you are hypertensive, sodium, salt is problematic to your health. Next, we're going to look at sweet potatoes. The potassium in sweet potatoes helps to regulate blood pressure. The potassium also relaxes the walls of the blood vessels, allowing for easier flow of blood, thereby lowering blood pressure. Let us look at these amazing statistics. 470 milligrams of potassium is found in half cup of sweet potatoes. Isn't that amazing? But let us also take into consideration that sweet potatoes have a high calorie content and it is also a carbohydrate. Therefore, we have to consume it in moderation. Followed by sweet potatoes is avocado. Avocado is a good source of potassium. Half cup of avocado contains 345 milligrams of potassium and only 5 milligrams of sodium, which makes it an excellent choice in helping to control or reduce high blood pressure. A diet that is high in potassium and low in sodium regulates or lower blood pressure. We are now looking at oranges and orange juice. Oranges and orange juice are a great source of potassium. Potassium is an electrolyte that helps to regulate blood pressure. Potassium also counteracts the effect of sodium, which can cause blood pressure to rise. Adding potassium to a well-balanced meal or well-balanced diet can help to regulate blood pressure and improve overall cardiovascular health. Next on the list of foods that contains potassium, which helps to reduce blood pressure, is beans. Beans such as lentils, lima beans, and kidney beans. What's great about beans is that they contain fiber, which helps to reduce cholesterol. The potassium in beans helps to reduce blood pressure due to its effect on sodium. We're now going to look at bananas. Bananas are an excellent source of potassium. Potassium relaxes the walls of the blood vessels, making the flow of blood easier, thereby lowering blood pressure. One medium-sized banana contains 400 to 450 milligrams of potassium, which is about 10% of our daily recommended intake of potassium. Next on the list is nuts. For example, almonds, peanuts, pistachio. Nuts are a good source of potassium, and we should take care not to add salt to nuts. Adding salt to nuts counteracts the effect of the potassium. And remember, salt is problematic for patients with high blood pressure. We are now at the point in the discussion where we're going to look at salmon. Salmon is a good source of potassium. It contains a high potassium content, which makes it an excellent source in helping to reduce high blood pressure. We have to take note that when we're preparing salmon, we should not add salt. Yes, we should not add salt during preparation because the salt counteracts the effect of the potassium. I know this is going to be sad for a lot of persons because what is salmon without salt? What is it going to taste like? It really tastes good. Just try it. Let me know. Type in the comment section when you do. We're now going to look at spinach. Spinach is a green leafy vegetable that is rich in potassium and other essential minerals. When you are preparing spinach, please do not add salt. Sodium counteracts the effect of potassium. Also, if you're using a salt substitute, you want to consult with your healthcare provider because the salt substitute already have potassium added and you do not want to be using or adding more than the recommended amount of potassium. Finally, on the list of potassium-rich foods that helps to regulate blood pressure is kiwi. Kiwi is a rich source of potassium. Potassium is an electrolyte. It helps to regulate blood pressure. It also has some effect on the blood vessel walls. It relaxes the blood vessels, allowing blood to flow easier, thereby lowering blood pressure. Potassium also counteracts the effect of sodium, which causes blood pressure to rise. At this point in the video, I'm going to implore you to watch my previous video, 8 Worst Foods that you want to avoid in 2023 when you are hypertensive. Today, I gave you 10 potassium-rich foods that you can consume to help in reducing your high blood pressure. Also, the daily recommended potassium intake for adults is 4,700 milligrams, but 4,700 milligrams is not for everyone. For example, if you have renal failure, if you have certain disease states, or if you're taking certain medications such as spironolactone or an ACE inhibitor, you want to consult with your healthcare provider so that a patient-specific plan of care can be developed for you. Also, do not initiate taking potassium supplements without consulting with your healthcare provider. Accompanying a high potassium intake, you also want to exercise regularly, avoid stress, get adequate sleep, and consume adequate water intake. Thanks for watching. I appreciate you. If you have not subscribed as yet, click that subscribe button and that notification bell too. So when a new video is uploaded, you will be the first to know. If you found this video to be educational or informative, press that like button and share with your friends and the ones you care about. Again, thanks for watching. Consult with your healthcare provider prior to initiating any high potassium diet or any potassium supplements.